Hello, everyone. My name is Adriana Krasniansky. I lead the research team here at Rock Health, and we're really excited to have a conversation today as part of the Rock Health Summit virtual series. We'll be looking into the investment climate for the first half of 2023. Now, I'm very privileged to have this conversation with three incredible women who are going to be sharing their perspectives, and we'll start by letting them introduce themselves. Deena, do you want to kick us off?
Absolutely. It's so great to be here, especially among such a wonderful panel. My name is Deena Shakir, and I'm a general partner at Lux Capital. We're a multi-stage venture capital fund. We've been around about 23 years, investing in everything from pre-seed to pre-IPO. And of course, health tech is a large area of focus for us and has always been, and is certainly an area where I have deployed a lot of capital since joining about 4 years ago. And we're often known for our big bets in women's health, although we invest in everything from biotech to AI plus health to virtual services for clinical trials and beyond.
Hi, everyone. I'm Alyssa Reisner. I'm a director and principal on the CVS Health Ventures team. So CVS Health Ventures is part of the CVS Health ecosystem, and we invest in innovative digital health and tech-enabled healthcare services in order to drive both financial and strategic value alongside the CVS Health assets. And so we invest across a wide range. We have an early stage vehicle as well as a growth equity vehicle, and I lead our investing on the early stage side. So really excited about the discussion today.
Good morning, everyone. I'm Anika, the Vice President of Innovation and Investments at the SCAN Foundation. We're the philanthropic arm of the SCAN Health Plan. And as a philanthropy, we have about $260 million that we get to put towards our mission, which is anchored in investing in the future of aging, specifically in home and community. We primarily do our work through policy and advocacy, as well as community engagement, but more recently, we've gotten into impact investing. And so we're primarily focused on strategies that allow us to exemplify our mission and support older adults, specifically in evolving models of care, as well as the challenges they face in financial stability, health equity, and something we're partnering very closely on with rockhealth.org is our efforts in tech and data equity.
Super interesting. I'm really looking forward to have all of you participate and bring your perspectives in for today's conversation, because as we know, it's a vastly different funding environment than what many of us at Digital Health have become accustomed to just through 2020 and through 2021. And so here at Rock Health, we've really been thinking about 2023 as a true marker of a brave new lower funding world. And that's kind of a term that we're using. And that's really not just for the startups that are raising funds or for the investors, but it impacts every enterprise, every organization, and every player, right? Because it determines how they might partner, the different relationships they can have on the table, and how they define success, both clinically and commercially. So today I'm going to talk a little bit just about some of the financial realities, how you're seeing that in the companies that are approaching you for investment and the ways that you're thinking about those decisions. But I'll also try to keep it broad as well, so we can talk a little bit about the broader sector climate, some of the drivers that are in the market, and then how we're tying that together both in terms of clinical, commercial, and mission-oriented value. So we'll kind of straddle between some more nuanced questions and some larger perspectives. So I'm going to start a little bit more so in that more nuanced space, talking a little bit about the numbers that we've seen so far in 2023. In the first half of 2023, US-based digital health startups raised about $6 billion, less than half of the $14.7 billion that we saw in the first half of 2021, just 2 years ago. So alongside these lower funding totals, H1 of 2023 also saw fewer investors participating in digital health deals. We had about 555, actually a very interesting round number or even number of investors participating in fundraises for this half 2023. But it's interesting when you compare that to the almost 800 that we saw in H1 of 2022 and the over 800 we saw in H1 of 2021. So I want to talk a little bit about this different environment, this more concentrated cohort of investors. And then let's start maybe with Deena. I'd love to hear a little bit about how has this environment maybe shaped or changed the types of companies that you're seeing come across your deal flow today? And then even a little bit about what some of the considerations factors are for you right now in this environment.
Absolutely. Thanks, Adriana. To us, it's neither surprising nor sudden. I think it's been a gradual shift over time. That certainly feels jarring when you compare year over year. But if you look at the environment a little bit more kind of month over month and even quarter over quarter, it is something that has happened over time and is going to continue to happen. So I think there are a couple of factors that play here. The first is that there was a period of exuberance that lasted a very long time, so much so that for many investors and founders, it's all they ever knew. And that perhaps reached its peak during those early years of COVID, particularly for health tech. And so what that means is there were many, many, many companies who were funded in this space at very, very high valuations and with lots and lots of dollars, perhaps more than they needed, perhaps burning more than they needed, and also bringing an entirely new kind of slate of investors to the table, many of whom had not ever invested in health tech and perhaps won't ever do so again, given where some of those valuations were sitting. So in that way, to me, it's unsurprising that we're during this period of tumult right now, where there is quite a bit of uncertainty, frankly, around where valuations will land in the long run, the sort of long-term venture outlook on the industry, that a lot of those folks are pulling back. Even separate from health tech, frankly, across every sector, you're seeing a lot of investors slowing down. You're seeing folks doubling down on their existing investments, which makes sense in a number of ways. Number one, you have outsized information on your own investments. Perhaps you wanted to get more money into them initially and couldn't. And now any founder, worth their salt is willing to take more because they should in this environment. So that is unsurprising in that sense. And the other side of it, of course, is that many companies simply do not want to raise external capital right now, do not want to reset those valuations. And so they are doing extension rounds or insider rounds, or I think as Rock Health recently reported, unlabeled rounds, right? And so we're seeing a lot of that, and that cannot last forever. It's already lasted quite some time. I think that's been happening, frankly, for the last year. But at some point, a Series A can only have an A1, an A2, an A3, and before it's time for a Series B. And it is going to be those sort of mid-growth rounds that I think are going to be challenging for a lot of these companies. So that's sort of some of the high level. One thing I do want to point out, which I think is really important, is a bright spot in an area that we care a lot about, women's health. And that is that despite all of these sort of macro, the macro headwinds and the slowdown, that if you look at women's health, and SVB actually just reported on this last week, if you look at 2018 first half versus 2023 first half, you actually see, I think, a 359% increase in deal activity in women's health versus something modest like 15% for broader health tech. And so there are some of these areas that have been historically underinvested in and undervalued that are continuing to see growth. And to me, that's a bright light amidst all of this.
Alyssa, anything to add in terms of just what you're seeing in the deal flow? Any bright spots that you're noticing?
Yeah, I think it's really interesting to hear Deena's vantage point from a firm that has been investing over a long period of time in healthcare, because CVS Health Ventures actually did launch kind of in the midst of a lot of that frenzy activity in digital health in 2021. And to be clear, we weren't new to investing or to the digital health world at that point, but we did launch our investment vehicles at that time, but I think have a pretty different vantage point as we think about where the strategic opportunities are in working with a large corporation like CVS Health. So we've been really focused on the commercial viability of each of our investments, even from that kind of point in 2021 when there might have been more focus on some of the hyper growth and less on some of the kind of building the basics in their commercialization strategies. And so what we're seeing now is a lot more of that market shift, maybe aligned to where CVS has been in kind of our natural DNA in thinking about the commercial viability and how are they working with the legacy healthcare system to really have sustainable business models. And so it's exciting to see how companies are really recognizing the need and opportunities that they can have in working with large businesses like a CVS Health when they are building their business plans.
Adriana, Alyssa brought up a really good point, actually, and we are proud co-investors alongside CVS and I think 4 companies, and hopefully more to come. But the other piece of the pie is that there is I think, more of an opportunity, and rightly so, for strategic investors to invest even earlier than they would have previously, particularly because everyone is looking for that commercial, point of profitability and revenue, and being able to have especially a helpful strategic partner who does help bring those partnerships to the table around the table earlier. We found those partnerships to be incredibly valuable for our portfolio companies.
Yeah, I totally agree. Maybe a little bit biased of, the power of potentially a strategic investor. But I think as we see some of those unlabeled rounds, some of that activity was insider rounds, but potentially new entrants of strategics participating in those rounds. And so that's where CVS Health may have had a little bit of a different deal flow over the last year, especially, I think, versus some of the institutional investors, because we were new entrants potentially into some of these insider rounds where we got to really have a different vantage point and thinking about where we can lean in and really support being, a seat at that table of talking about the commercialization strategies and their broader businesses.
That's so interesting. And I want to come back a little bit to that opportunities and realities of working with legacy organizations. But really quickly, Anika, I'd love to hear from your vantage point. One, investing from a foundation perspective, how that might feel a little bit different and what that looks like today. And the second part is really focusing on those aging care solutions or aging care complements. How have you noticed potentially any changes in a more concentrated or kind of a smaller sector within digital health?
Yeah, fantastic question. And first and foremost, a +1 to what Deena and Alyssa mentioned. Clearly, it is a harder market to raise. Everyone is getting scrappier, more creative in their sources of funding. For context about the SCAN Foundation, we invest in funds and also make select direct investments as well. So we kind of look at both sides of the venture landscape. And I'd say compared to prior quarters, for us as impact investors, again, mission is priority within our investment analysis, we're seeing more willingness and opportunity from funds and to some degree entrepreneurs to align with our priorities in the aging space. So part of our investment strategy is that we look to make investments where the SCAN Foundation can either reinforce a market. We're seeing a lot of age tech funds and VCs come up, as well as where we can build a market that centers aging populations on their decision making, but could have alignment to workforce or housing strategy. And so in that build the market category, funds and spaces adjacent to healthcare and aging, we're seeing an appetite to have an outsized commitment to aging as a part of their investment thesis, which really wouldn't have been entertained before. I think we're also seeing a greater opportunity to target lower and middle income older adults. For us, this includes Medicaid as well as the forgotten middle. This is a growing segment of older adults that do not qualify for Medicaid, but can also not afford the healthcare services that they need, as many of those come with out-of-pocket expenses. This is crucial for us as a foundation because a significant portion of the digital health VC dollars go towards Medicare Advantage or some of those out-of-pocket services. And so what's unique about this time frame is that we are able to frame our expectations and requirements with funds and newcos that we require our priority population, within the older adult space to be at the center of our investment. It's not just a box tick. And so with our impact investing work, we're really seeing an opportunity for mission to shine through very clearly right now.
Yeah, something I'm even kind of just hearing across all of those answers, right? And even different investing environments is a resetting of expectations on both ends. And also the ability of whether strategics or foundations in particular to bring forward, whether it's their mission or their central commitments and vision, which is a really, I think, an interesting rebalance and probably a necessary rebalance that kind of took a pause in the market. Alyssa and Deena, I want to come back to a little bit of the conversation we started to have around partnering with enterprises. We know that for many, as you mentioned, early to mid-stage players, this is where we might be seeing, we definitely need to see some of those proof points, right? And longevity of those relationships is important, proving out outcomes. We also know that in the same way that many investors made investments in 2020 and 2021 that they might have not made in other climates or contexts, we saw several partnerships that might have been made in that context, especially around telehealth or digitally enabled services that were really, part of the moment in time. And we're seeing that a lot of those relationships are very naturally coming to the close of their contracts, right? So up for renewals, having some of those conversations and points. So I would love to hear a little bit just there, Alyssa in particular, from the strategic perspective. How are you hearing, from all sides potentially of the CVS business, how the way that you're evaluating a startup relationship might be different, or what's expected of a startup partner?
Yeah, I think that there's definitely kind of the two buckets that definitely interrelate, but have different components as we think about partnerships versus investments. And so, from a partnership perspective, I think that we see a lot of focus on ROI data, outcomes data. How are you actually proving value? We see the point solution fatigue that is happening in the broader market, especially for employers. CVS Health as a payer and even from a PBM perspective, are playing a role in how we're helping our employer clients and other types of clients consolidate and really identify who are going to be the right partners to come to their audiences. And so there's much more focus, not just on scale of, okay, when you're telling a pitch, this digital health company has served thousands of patients, but more around what value has it actually provided to those individuals, and therefore how do you make a financial case for making those partnership decisions. And how that translates into the investment side, I think has a similar flavor. What we saw a lot of activity in 2021 especially, I think, was a focus on hyper growth and how many patients can you acquire, how many different markets are you in. And now we're looking a little bit differently of how much market penetration do you have in a certain state. How are you actually proving that ROI to your clients to then get bigger contracts? And so I think that the milestones have shifted a little bit with more focus on the actual value that the solutions are providing. And that comes in a little bit of different flavors of really thinking about, the financial statements from an investment side, and thinking about unit economics, but that's certainly translating for a partnership perspective as well, as they're thinking about, potentially consolidating or, focusing on which digital health solutions we're continuing to work with and bring to our clients.
Really appreciate that point, Alyssa. And I hear a little bit about these milestones being codified or being captured as we think about outcomes. So Anika, I'd love to hear a little bit from you just about how the SCAN Foundation is thinking and working in partnership maybe to help those, potentially those portfolio companies or even those funds establish and hold some of these innovations to clinical and commercial outcomes.
Absolutely. I think Alyssa really framed that correctly in terms of the way that milestones are shifting and being more quantitative. I think in prior quarters, prior years, there was a little bit more space to be a little more qualitative, or the hope of what could come. And today, we're asking funds, we're asking startups to shore up their measurements and their outcome narratives. From a foundation perspective, when we come alongside a fund, we not only want to deploy capital and make an investment, but we want to ensure that commitment to outcomes and measurement is very clear. And so for different funds that we've partnered with, sometimes we'll do an impact report, and we will help fund the evaluation of that a portfolio assessment to better understand how the ROI can be quantified. That, of course, supports the portfolio companies. That, of course, supports the investment in the fund to have that quantified example. And I think for a lot of startups, it's very hard, when they have so many competing priorities and the challenges of being that entrepreneur. It can be really hard to find the capacity and the scientific rigor, if you will, to do solid outcomes reporting and analytics. And so that's an opportunity where we see that we can come in and partner.
Deena, anything to add about how you're thinking about outcomes reporting or outcomes data?
Yeah, I mean, from our perspective, it's important to note that fundamentally we're investors. And so, I have the word capitalist in my title, and One of the beautiful things about healthcare is when you can align those incentives of creating value in this world, and making people healthier. And it's one of the reasons it's an area I'm so passionate about. And so for us, a lot of that ultimately does come down to outcomes, particularly in a world that is moving more and more towards value-based care. And so there are many different examples of that. It really depends on the type of company, and it's hard to generalize, but I can give an example of Maven Clinic, where CVS and Lux are both invested, and I'm on the board. And that company started off really focused on, well before either of us invested, on D2C maternal health. And over time was able to get enough traction and trust with users to penetrate into the employer space. And once they were able to penetrate into the employer space, where they're still a dominant player, in fact, just announced a big partnership today with Amazon, they were able to get exposure to payers. And most importantly, they were able to have enough of an N to show outcomes. And that's what got them, probably got the attention of folks like CVS, and was able to get them into Medicaid and into the, half the babies in this country born under Medicaid, a space that is desperately needs that type of innovation. And so that's kind of the journey of how we think about outcomes data. We want to be investing in companies that are making a difference. And so it's definitely something we look at, and that's important to us. And depending on the nature of the company, sometimes you can see the outcomes in terms of, for example, in the case of Maven, C-section reduction or NICU reduction rates, before you're able to see those dollars on the table. So it's another metric that we look at and evaluate. And certainly something that we believe very obviously does matter to the payers in the space who are looking to partner.
Yeah, I really like that lens of kind of the path. You said the path to outcomes, right? So it's kind of alongside the growth path, where does outcomes reporting, or which outcomes need to be reported when, both to open doors for commercial possibilities, but also to continue, kind of, Anika, something you built off, to continue to prove out the true possibilities of the product, right? And I think there's something really interesting also, Deena, you said about the right N sizes or the possible N sizes, right? Because sometimes we can see that be maybe either a red herring or a distraction if it's not at the right point or not set up for success, and for all players, right? Really
right. And of course, outcomes can mean something very different to different types of players. There's, peer validated research and journals reporting outcomes in terms of clinical outcomes. There are outcomes in terms of cost savings. There are, anecdotal outcomes. So there's really even a spectrum of what that word means as well.
So I want to play a little bit of I thought might be a fun way for us to all comment quickly on a few different topics. So one thing that we at Rock Health really look at is not just the numbers at the top line, but also what these kind of foundational changes are happening within the digital health sector that can give us a little bit of an idea of, what's a market driver, what's a market barrier right now, and how are those manifesting for scores of different players. And so as part of this game, I'm going to name a few different quote unquote drivers that we've heard of or other teams are reporting on. And I'd love to just hear from each of you which ones really resonate and which ones might not resonate so much for a variety of different reasons. So what I'm going to say is new technologies being developed. You can take that for what that is. If we want to talk about AI, if we want to talk about biosensors, that's something I'm thinking about there. Another one is reimbursement, regulatory, and model innovation. So this is really, Deena, you mentioned a little bit about VPC enablement. I'm really also thinking about some new CMS models, and that might be really interesting for you all. Workforce shortages, I'm really thinking more so in the clinician and caregiving space, but that's something I'm interested to hear your thoughts on. And also consumer demand, right? So what are our patients and members and consumers really interested in? So I know it's probably hard to choose out of all of those which ones feel most resonant, but would just love to hear folks' thoughts.
Yeah, what a list there, Adriana. All of them are huge market influences, but I'd say, again, from our perspective, especially thinking about older adults, the regulation, reimbursement, and model innovation, as well as workforce shortages, really stand out. Many of the resources that are needed to age in place remain out of pocket for older adults. And so we continually partner with our policy team to look at what the landscape for regulation, reimbursement, and model innovation looks like, not only at the state level, but at the federal level. And the progress that is needed. There's a lot of great pilots. There's a lot of great progress with things like the multi-sector plans for aging, but we're still seeing a lot of the day-to-day costs that allow older adults to successfully age in place remain out of pocket. And of course, you touched on workforce, and there is a huge shortage in workforce for clinical staff, but of course, caregivers as well. And really, the unsung hero of the American healthcare system is caregivers. And I can't quote the statistic correctly, but I saw some research recently that it seemed like the average age of a paid caregiver is increasing, and it's around 49. So the caregiving population is also getting older, and we're not seeing sort of the supplemental pathways to support them as they continue to age, but also that next generation of solutions. And so that's really one of the market forces we're leaning into.
Really appreciate that.
Yeah, I would love to build on that because I totally echo that all of those areas are so important for the market. But the two that I would really amplify is that the consumer adoption. I think that oftentimes when we think about the consumer, we think about some of the D2C models or even kind of like more classic B2B2C. But ultimately, most care delivery solutions require buy-in from the end patient or the end member who's actually utilizing it. And we see one of the biggest barriers to really being able to scale and make that impact is in getting that upfront adoption and ongoing engagement from the user to really drive into those outcomes data and all of those things that we've been chatting about before. And so I think really putting the consumer at the center, even in solutions that are a little bit more traditionally thought about as B2B focused, but how is that actually, translating down to the end consumer is a really important part. And I love that intersection with health equity. I think especially the healthcare ecosystem has caused a lot of mistrust of individual consumers in new healthcare solutions or advice that's coming from different audiences. And so health equity, I think, is such an important piece in being able to build that trust so that we're actually helping the populations who need these healthcare services the most and are actually getting to adopt and be able to utilize them. And the other piece I'll say, you could probably count the amount of times that I say commercialization during this webinar is because that's what I think about all day long. I used to be a partnerships person, now I'm an investor, and I think about the business models. You can have, as much technology innovation as you want, but at the end of the day, if it doesn't fit into a reimbursement model or a business model that really can be adopted at scale, we can't really see the growth of that solution. And so being really savvy and thinking about new regulations and ways to drive more adoption of value-based care is really important. And so, we're still sending faxes in the healthcare ecosystem. So there's a lot of space, even for like past generations of technology advancement, and certainly more for future technology. But actually bringing the business model side to those new technologies is a really key area that's going to be needed in the market right now.
Yeah, I think Alyssa brings up a really great point. I mean, for those who know Lux, we're known to be investors in cutting edge technologies. We love to believe before it's obvious. We're very bullish on AI writ large, including the application of AI to healthcare, as well as a number of other areas from hardware to software and everything in between. But all of us here know that when it comes to healthcare, the technology alone is not going to create a business. It needs to be something that somebody is going to pay for and continue to pay for, and that makes sense, and then ultimately contributes to outcomes. So all of the themes we've discussed, commercialization, outcomes, partnerships, et cetera, are all really important there. And so that's kind of the context in which we think about things. I often use the example of the COVID vaccines as one where it was an absolutely cutting edge technological breakthrough to get these RNA vaccines available in record time. And yet that alone was not enough to get shots in arms, right? We needed to meet patients where they were. We needed to have a variety of different partnerships and so on. And I think that is sort of a microcosmic example of how a lot of things work in healthcare. It's just not enough to have only technology.
So interesting. So I think one thing that I'm really hearing from all three answers is that it's really interesting and refreshing to hear investors in particular think about the consumer as a partner in success rather than just the object of TAM or SAM or SOM, right? Really thinking about that being as a key linchpin to the next stage of adoption, support, evolution. One thing I'd love to just quickly double click on and hear if there are any additional thoughts. Alyssa brought up a really interesting point around commercialization and finding the right model for the product or the innovation to reach the right consumer and to work hand in hand with the customer, which might not be the consumer, as well as the consumer or patient. Deena or Anika, any questions that you have or you're thinking through as you think about business model fit for some of the companies that you're seeing right now?
Yeah, I'm happy to start, and I'd love to hear your perspective as well, Anika. So, again, very different types of questions and frameworks for evaluating different types of companies. But to my earlier point, business model is crucial. It's complicated in healthcare. Certainly, many companies either start off D2C or try to build a product that is delightful and works with an initial D2C engine, but ultimately to be able to get to scale. And to be able to, reach outcomes and reach the majority of this country in terms of improving healthcare, you do need to partner with payers and to kind of go through that sort of lens. And so one way of doing that is going in network, and that's not something that's as many mom and pop shops can do that, and that's fine. But to be able to get to these broader, big, kind of large commercial partnerships with payers is really, really interesting to us as investors and really hard, and something that certainly Alyssa and her team can help do with their strategic involvement. And that's why you're also seeing a lot of other payers who are coming to the space as investors as well, because it's an absolutely invaluable part of contributing to a long-term sustainable business model.
Yeah, no, again, noting the market environment, knowing how it has shifted to be more quantitative, to be a little more conservative. That pathway to commercialization, again, we talked earlier about milestones. It is critical to make sure that we have, as we look at investments, we see that rationale and that framework for them to work towards establishing those large partnerships or being able to create an effective argument, if you will, that warrants bigger accounts, that warrants bigger sales in due course. And so I think for us, one of the things that we sort of differentiate and work with our funds and also with our investments on is really thinking about how to reach that level of commercialization, that stickiness, how their engagement model upstream is effective in doing that. Mm-hmm. And so one of the things we're also seeing more interest in is activating CBOs or local community players to help one, introduce some of these new innovations and make it a little bit more palatable for, again, in our case, the older adult population to engage with, but then also to have them as a viable partner to speak to the impact and speak to more of those outcomes and the measurement of that solution in practice has really been a valued narrative when looking for that next big commercialization opportunity, investment, etc.
Super interesting. I know we're going to be coming up just at our time here, but I wanted to pose one last question to you all. And that's a little bit about the term I started us off with, which is kind of this brave new lower funding world. I'm really kind of taking a Huxley term here for ourselves. But what I'm interested to hear is usually when we think about that, we tend to think about startups, right? It's a tough environment. They're making some really brave choices right now in terms of how they're structuring and their path forward. But I'd love to also pose the question to you all. What do you think it means for you and your teams to be brave right now? Whether that's holding your mission and some of those conservative, quote unquote, financial risk management needs, or if it's pushing forward into a new frontier in healthcare. So maybe Anika, you can start us off.
Yeah, as impact investors, of course, we think it's our time to shine. As we have more patient capital, we can lean in during seasons where traditional players may be more conservative. Again, you've heard me talk a lot about our mission, and for us, it starts with mission versus market. But don't get me wrong, we're not fiscally irresponsible here. But there's definitely areas that we want to continue to catalyze and continue in enabling growth. And there's some really exciting efforts. I think an example that brings this to light is some of the work that we're doing around introducing transparency and democratizing access to best practices, and ultimately what we hope will spur and drive competition around responsible and equitable AI. So we're looking at some partnerships and some collaborations with emerging solutions around algorithmic audits that can then help leading health system and payers evaluate their algorithms for bias so that we stop perpetuating the inequities for our highest need patients. And so for us, I think, continuing to lean into emerging spaces like algorithmic audits, for us being brave really challenges us to go after those market enabling responsibilities and the ecosystem that we believe will contribute to successful aging. And with that, we'll continue to lean on our research, our community engagement, our policy work to shape where we believe we need to invest next.
I can jump in next. So for me, really being brave, I think one big piece of that is that we saw, a lot of the new entrants of digital health investors in 2021, including our team, but also a lot of exits. And so for us, a lot of this is making sure that we're staying the course and really believing in the model that we are investing in a place where we are driving sustainable financial and strategic value through our portfolio of investing. And so that includes both continuing to invest and often in many of these themes and evaluations that we've already been talking about and thinking about really centering the consumer and thinking about health equity and the outcomes that we're really providing from a health standpoint. And then also really showing how we're going to drive value. So we are still relatively new investors in the market. And so our focus right now is really in putting, the work where we are saying we're going to add value, but actually translating that. And so we're starting to see more of those relationships come to fruition, but really focusing our staffing and the way that we are spending our time to really deliver on the value that we have signed up for, to be supporting our portfolio companies in their mission to drive, better scale in the way that they're impacting individuals.
Wonderful. All right. Well, I'm so grateful again to you three. It's such a pleasure to be with such sharp perspectives, and it makes me really look forward to what the rest of 2023 has in store.
Thanks for having us.
Thank you.